Thank you for joining us all over the world. It is pretty exciting to be speaking to people in different time zones right now. And I'm sitting here alone in my office early in the morning in Toronto, Canada. My name is Mike Prosserman, and I'm the founder and executive director of Unity Charity. So, as I said, I'm going to share my screen now and I'm going to get started. Okay, great. I'm going to start off with the video. There we go.
I'm always upset. I feel worse when you're home. I'm unhappy, and I'm sure our daughter is unhappy too. Honestly, we spend so much time at work, we're at work all day, all night, all week. So is our daughter.
So that gives you a bit of a vibe about what we do at Unity, and essentially how we're using hip hop and the arts to help young people express their stress and develop skills for success. So I'm going to jump right into it. Again, please stop me if you can't hear me, but I'm just going to assume everything's good to go. This is my first webinar, so I'm just excited to hear that there's other people on the other side of this. It's very, very cool. All right, so I'll tell you a little bit about myself, how Unity got started. This is me when I was a baby. When I was 3, I used to watch TV and cartoons on my head, and my mom thought there was something wrong with me, so she made sure that I got into gymnastics and would learn how to do this properly so that I didn't break my little neck on the couch. As I grew up with a mother who was battling through a mental illness called schizophrenia. I don't know, for those of you who are aware or not aware of what that is, but she would essentially, as a young person going through this and seeing her go through this, it was pretty scary, and it was confusing to see someone that I really loved and cared about battling through this, very challenging mental illness. So as I grew up, I became very quickly almost like a caregiver for my mom. And I also wasn't very good at dealing with my own personal stress levels. So it would really build up inside of me. So I would, just get sick because I would be so full of stress and dealing with all the episodes that were happening with my mom as I was growing up. My mom and my dad got split up, so I was spending a lot of time with my mom and just really taking care of her and making sure she was okay. So, fast forward till I was 13 years old, and I essentially found breakdancing, and as I call it, b-boying or b-girling. I just saw someone do this spin move on their hands, and I knew that I wanted to do it. So I picked it up, and I got really into it, and I joined a crew. Crew is like a family of friends who practice together, and we traveled all over the world and danced and competed, and they became like a second family to me. That community was so important, and that support network just amongst kids who had the same passion as me. So that's really how Unity got founded, out of that same passion and out of my own story. But now it's a story of many young people that we work with and connect with. What we do is Unity uses the arts, specifically hip hop, so breakdancing, spoken word poetry, graffiti art, beatboxing, emceeing, to help young people, to empower young people with the confidence and the skills they need to succeed. That's in their education, in the workforce, and even just getting through the day, having these tools as ways to get rid of their anger. Unity's promise is to use hip hop to improve young people's lives, creating healthier communities, healthier being physically, but also mentally healthier communities. what we do, we run programs directly in schools and also in community spaces using hip hop as a vehicle to give young people a voice and give them a stage so that their voice can be heard. Again, our tagline is express your stress and develop skills for success. So we believe having a tool that young people can cope with their stress is a very powerful thing. And we've seen it to be a very powerful thing for young people to focus on school, focus on their day-to-day experiences, and just having that community in their lives. Why hip hop? So, sometimes people say, oh, hip hop is this big negative thing when they listen to the radio, but what we promote is positive hip hop, really the roots of hip hop and what hip hop originated from, which is, back in the day in the Bronx, young people who did not have a voice were using hip hop to share their story, and it was actually bringing together people who were oppressed and didn't have that voice to do something positive. So it's a powerful tool. It's a relatable tool. It's accessible. You don't really need money to do this thing. Like all you need is, at most a pen and a piece of paper, and sometimes not even that. Like you just need your body and a floor. I've seen dancers who are located in Uganda who I've met who, they have their own way of doing ciphers and dance circles. I've met dancers in Korea, in Jamaica, in different parts of the world who are all using hip hop and dancing and emceeing. It's a very universal tool that is also spreading very quickly all over the world. And the beautiful thing about hip hop is it's a community. I mean, outside of Unity's programs, the young people who get involved in our programs, they have a huge hip hop community to become part of once they leave the doors of our program. So there is a huge support network, a group of friends that they can connect to, and a place that they can feel valued for something if they don't feel valued for anything else in their lives. And again, it's a stage, and it gives young people a voice they may have never had before. So Unity's audience, and Unity's a registered charity in Canada. We've been around almost 10 years now. I started it back in grade 11 in high school, and now I guess I'm not in grade 11. I'm 30 now, and we're growing up, but it's almost our 10-year anniversary. So we essentially, for our audience, the young people that we target are young people who may feel disconnected and overwhelmed by stress. So we don't want to single out our young people, the young people in our program, by making them feel like something's wrong with them. So this is always a challenge and a sensitive balance by communicating something clearly and also not making people feel like there's something wrong with them. So this is a description we use publicly around who we reach out to. So, if people don't feel connected to their community or to their school or just get overwhelmed by stress, it might be a precursor to some mental health issues or even just a community that they need to be a part of or want to be a part of. So now I'm going to get into our theory of change. Just going to time check. Yeah. We just actually redeveloped our theory of change with a consultant from Innoweave. It's an organization in Canada that helps develop, they have a strategic clarity model, and we've now gone through that process. So I'm going to very quickly step through this slide. On the left, you'll see inputs. So inputs are the different people who make our programs possible, the people we need to train, the people we need to make sure are absolutely ready before trying to make the change that we're trying to make at Unity. So those are the artists, the volunteers, the teachers, the partners in the community, and even the school boards. Then we move into this blue circle, and you see the word inspire. So under inspire, 3 of our programs are located there. These are the ways we reach out to communities. So we actually go into a school or into community space and do a full day presentation where we're performing, we're teaching workshops, we're doing ciphers, which are big dance circles or big circles where people share their art, and we just get people hooked. The goal is get people, young people, hooked on our programs so that when we move over to the other side of the circle, which is engage, we are then providing ongoing programs. So we want to get them hooked into our ongoing programs, and once they think it's cool enough and it's something that they want to be a part of in the inspire side, they move to the engage side, and they come every single week, sometimes multiple times a week, to our programs located directly in communities where there aren't there isn't access to similar types of programs, and we teach for anywhere from 2 to 4 hours a week in the same locations. And right now we're in about 21 locations across our city in different underserved neighborhoods and communities. And the ultimate goal is to help young people develop stronger protective factors leading to improved mental health and well-being. That is the reason Unity exists, and we are in the process of trying to measure that, which is another exciting challenge. So I'm going to move on. I'm going to very quickly show you a little bit of some photos from some of our programs. This is our artist training program. Our artists are an input into our theory of change, into our process of trying to improve the mental health of young people through our programs, but they are a very important, very, very important part of that magic happening, because without incredible artists who are incredible people who are constantly trying to become better youth workers, we would not be able to run these programs. These are the frontline workers of our work, so we have to invest in training them, in sharing with them what our outcomes are and how we expect them to sort of be achieved, and also letting them be creative and give us ideas on how they can how they already do it or how they want to do it and add their personal twist to it. So it's really about involving the young people who are teaching the programs as well in the process of creating a curriculum that is constantly being reiterated. Our school programs, like I said, we do these outreach programs that engage young people and then get them hooked into our ongoing programs that happen both in school settings and in community settings. This is actually a program that takes place, this photo, in the Art Gallery of Ontario, so a very formal institution. We take over with, originally it was about 15 to 20 breakdancers every Wednesday. Now we have, on average, about 40 to 50 young people showing up in a very traditional institution that gave us the space. And you can just see that it brings together people of all backgrounds, shapes, sizes, and interest levels. Even different parts of the city, people will travel to get to this program because it's so powerful. So I'm going to just quickly go through some of this stuff here, which is the fact that we are getting more intentional and doing a lot more evaluation on our work. We had consultants donate their time to help us write strategic plans, to go through our HR, governance, all this stuff that I didn't know about that even existed. We had to sort of go through that and had the support of social venture partners and Innoweave to essentially donate their time to help us create these tools that created an organizational backbone for us to actually be able to provide these youth-focused programs around mental health. We've also contracted some researchers. Cameron Hausman has done a literature review on our program, comparing it to North American after-school programs, showing how we're hitting best practice. And we also work with a bunch of different social workers who essentially have helped us create a codes of conduct in working with youth, so the do's and don'ts of working with youth who may be experiencing certain challenges, and how to essentially navigate difficult conversations, how to refer and help young people get the supports that they may need. See, the challenging thing with us is our artists are not social workers, and we don't say that we are social workers. We just do the art. That being said, we have leadership and discussions and reflection moments where young people will share their stories, especially if they are going through different challenges. So we have to very sensitively deal with these pretty important themes that need, when young people are asking for support and reaching out, it's because maybe they don't have an adult in their life that they can trust, and they don't feel like there's a safe space in their life that they have, that they can actually really be themselves or talk about their mental illness or their brother or sister who might be in a gang or whatever the case be, because they've developed a history of not trusting adults. So when young people do come to us, we often find they do open up, and we have to have a process to help navigate them to the right resources in their community or connect them to the right counselors. So that's a little bit about our evaluation, and we are going deeper. Like I said, we did this lit review showing that our program is hitting several best practices. I think number 5 is key to me around hiring the right people or bringing in the right staff, having the self-efficacy component, stress management, these sorts of things. We've also done some surveys on our work showing that 74% of young people have more ways to express their stress. 70% have developed more respect for their classmates and peers. We even did a pre and post study showing that young people had statistically increased their leadership and empathy, their leadership skills and empathy as a result of our program. So we are going further into some of this stuff. We've also done a study on dance and mental health, showing that the more time that young people spent in our youth journal, and these are some of the findings here that you can see: strong sense of community, develop skills for success, positive youth development, positive peer relationships, and a safe space. So, I mean, these are the types of things that our programs foster to help young people just create themselves and find themselves. I'll sort of just wrap up on the last few slides. The Governor General of Canada and his wife became patrons of Unity. They're huge advocates of mental health. They're great supporters of our organization, and we're pretty young in a sense. We're not like an hugely established nonprofit in our country. So the fact that they've extended their connection to our program and helped promote that has been really beneficial to us. They've also invited us to become part of MHIN here in Canada, and now I'm being part of this webinar, which is a true honor, and I'm sure I have tons to learn from you all who are on this call as well. So again, I appreciate just the honor of being part of this, and I hope there's some things that people are taking away, or ideas that are coming. We are also working on a manual right now that's not complete, in which we can share how to work with a group of artists in another organization. How do you train them? How do you involve them in the process? How do you use contracts to ensure that it's clear what they're supposed to be doing, et cetera, et cetera. So down the road, when this manual is complete, I'd be glad to share this with all of you. So last few slides here. Right now we have 21 weekly programs across our city, an average of 17 young people coming out to them. So approximately 350 young people in programs every single week. And over the last year, we've reached 51,976. Us, it's about relevance, and we want to connect young people to something they truly care about before advertising that this is dealing with mental health, because we want to bring people in who may not come or be part of regular quote unquote programs. We also spend so much time engaging and training the right facilitators for our programs, because it's critical in terms of the outputs that they produce. Because if we just say, hey, teach this workshop, and they go in and do it with no training, no understanding what we do, it's not effective. It won't hit the outcomes we're striving to achieve. Creating safe and encouraging space. So we actually not only give them a space to be in, but we create curriculum and lessons that allow them to become themselves in a way they've never had that opportunity. Just true safety with the facilitators who create this incredible space to be in, to express themselves and be themselves, and being part of that larger community. So here's a few quick photos of our programs across the city. to give you a visual of what things look like and how we're doing our work. And again, if there's any questions, I'd be very happy to answer them later in the presentation. Thanks, guys.
All right, thank you so much, Mike. I'm going to show myself here very briefly. Let's hope this works. Hi, hello, I'm Doris. I just wanted to give this a bit of a human element because it's a little odd speaking into a computer and not knowing what's on the other end. So is everything going okay for everyone who's participating? Can you guys hear okay? Can you guys see the slides? Raise your hand if there's any trouble. You're also welcome to use the chat box to let us know at this point if there's anything we should adjust before moving on. Everyone happy? Georgia's happy. Good. Well, let's hope that more people than Georgia are listening and move right on to Heather Gilberds from Farm Radio International, who's been having some audio troubles, so I hope you can speak to us now. Heather?
Yes, I'm calling over Skype. Can you hear me?
Yes, fantastic.
And I'm still in the system, but then the audio is through Skype, so it's yeah.
Okay, so let me fire up your slides then, and I'll let you take it away, and I can play your video. Should I start with the video? Heather? Okay, not sure what happened there. I guess I will start with the videos. So Heather also had a video about the work that Farm Radio International does. Let me share that with you. Can you guys see that okay? Oh, I don't know, you can't answer. Okay, here it goes.
You know, in Africa, the mental illness, we don't take it seriously. We're sitting on a time bomb. There's not much effort to address the mind.
There's a lot of stigma around mental health. One group which is more affected with depression, teenagers.
I feel I'm alone, that's why I had to give myself.
There's a lot of legitimate gaps.
For this year, more than 10 people committed suicide.
Kawaje. Kawaje. I said Kawaje. Kawaje. You're simple. She give me the shot and it's back on air. Tell me my crowd of
This program is changing the culture of the youth in Malawi because they're now opening up to talk about depression.
Kids know that if a celebrity is going through something like that, I can also go through that.
We have been so dramatic because we have lost a lot of youth here in Malawi. Kawanje Azirians have been popular. People were here to see who are the producers, you know, who are bringing these good things to us.
They can make the audience to be attracted with the dramas.
I go to Kawanje and discuss good things with friends.
I like that thing.
I was surprised. The time is very short, the impact is significant.
So if you have youth who are mentally disturbed, who are stressed, how do we have good leaders?
This is new to me and to my students, to all society. would say people have started changing and people have started looking at mental health in a different way.
People are aware, and if you become aware, then you will want to seek help. But it is still challenging because we don't even have that capacity.
After maybe 5 or 10 years, they become fathers, and others become mothers. So it will give chance for them to spread this education to their children.
Okay, I hope that worked well, and I'll hand it over to Heather now.
Thank you very much, Doris. If you wouldn't mind putting a no chat window if you can't hear me. I've been having some technical issues this morning. So thank you everyone for attending this webinar as part of International Youth Day. As Doris mentioned, I am Heather Gilberds, and manager for a Canadian charity called Farm Radio International's mental health program, which was implemented in Malawi and Tanzania. The program, which recently ended this year, was funded by Grand Challenges Canada and was a partnership between Farm Radio Trust in Malawi, and Canadian psychiatrist Dr. Stancher. I'd be wondering at this point, as many of you know, how an organization called Radio, which typically works in the field of small-scale agriculture in Africa, got into the business of mental health. Knows a lot about how to use radio to entertain, to mobilize people, to change ideas, and to advocate. We've been ensuring that radio reaches farmers with crucial information to help improve their lives. When Kucher, who's a very well-known psychiatrist in Canada, approached us with the idea for a mental health program, we didn't think it was too much of a stretch to apply our expertise to help youth deal with stress and reach young people in crisis. As Doris kind of mentioned at the beginning, in many countries in sub-Saharan Africa, mental health issues are very poorly understood. They're attributed to laziness and, in severe cases, spiritual possession. There are very few to no services available to help people struggle with mental health issues, and even in places where there are some services available, people often won't use it because of the stigma associated with seeking help for mental health issues. So at the outset of this process, you can imagine with an enormous task. It's a topic that they wouldn't normally find in mental health, and actually the focus was on depression. Radio show and school mental health clubs. But first I'm going to talk about a couple of other elements of the program that are not exactly related to how we engaged youth, but are important aspects of how we work to create systemic change in Malawi and Tanzania. I can't seem to change the slide. Oh, there. Okay. So one of the elements of the program was curriculum for teachers in secondary school. So we adapted a program that Dr. Kucher developed for use in Canadian schools, and we trained teachers to integrate a curriculum of mental health into their classrooms. Given that teenagers spend the majority of their lives in school, it's a natural place to reach them. And teachers are experts in delivering information to young people, as on the skills that they already possess. As they participated in the program, teachers not only had greater knowledge about mental health that they could then pass on to their students, they possessed greater empathy towards them. They were better able to know when students needed help, and they knew how to talk to them and how to recognize if they were in crisis. As part of the school program, we trained peer educators, young leaders in their schools, to organize and facilitate weekly mental health. They became our champions, mobilizing their fellow students and maintaining the momentum. And the third element of the program is we trained healthcare workers in community health centers how to screen for, diagnose, and treat depression in young people. In countries such as Malawi and Tanzania, where there are only 2.5 health workers trained in psychiatry for every 100,000 people, there's a great need for community-based mental health services. Also, health centers are typically not youth-friendly, and part of the training focused on helping health workers better talk to young people without judgment and with strict confidentiality. So exactly as Mike was explaining, a lot of the times young people don't trust adults, and they especially don't trust health workers. When they go in for treatment, often health workers will tell the parents or the teachers or the school administrators that the youth was help. So the element of the program that's most relevant to today's talk on how to engage youth, and also one of the most innovative aspects, was a national radio campaign in each country, intended to inform youth about mental health and also to open up avenues for discussion about all issues that teenagers face that may affect their mental health. The radio programs touched on highly taboo issues: sex, drugs, teen pregnancy, relationships, that youth often are not able to talk about with anyone else. We had three main objectives for the radio program. So the first was to reach and engage a wide variety of young people in discussions about mental health and related issues. The second was to increase knowledge about mental health issues, including where young people could go to get help and to help reduce stigma. And the third was to encourage young people to reach out if they or someone they know needs help. The 30-minute weekly radio shows called Nkawa J in Malawi and Positive Mood in Tanzania, as you saw in the videos, are made up of a short serialized soap opera, live music, call-in question and answer with mental health experts, all with the aim of putting mental health on the agenda as a topic of discussion for teens. So to give you a mental image, at the launch of the second season of Nkawa J in Malawi, thousands of young people yell, "Nkawa J, Yonsibo," which actually translates to a depression-free life is cool, in a boisterous call and response initiated by the popular host, The Dictator. The radio program reaches hundreds of thousands of youth in Malawi each week and is one of the country's most popular radio shows. The crowd, all dressed in Nkawa J t-shirts, erupts as the dictator walks into the village to record a live broadcast of the radio program in their community. Throughout the day, people compete in hip-hop dance tournament competitions for the best song about mental health and a football tournament between school mental health clubs. In addition to these live events, to help keep youth engaged, we used a mobile phone platform to make the shows interactive. Each week, school clubs or individuals could participate in polls and quizzes free of charge or leave a suggestion or question for the radio program. In both countries, the radio host was a local celebrity hip-hop artist, someone young people look up to and admire. One of the most popular segments of the show was a short, like approximately 4 to 5 minutes each week, serialized soap opera about teenagers dealing with the tough decisions and stress that they face in their lives. The series in each country follows a teenager's descent to depression, their battle to overcome it amidst misdiagnoses and stigma, and ultimately their recovery from it. The heart of the radio shows are the issues that teenagers told us are important to them: exam stress, relationship, arguments with parents, teenage pregnancy, suicide, substance abuse. Underwriting each of these issues is information about how to maintain mental health and what a young person can do if they think they might be suffering from a mental health disorder. One of the primary reasons that radio programs were so successful in each country is that we involved young people in every stage of production, from the initial design through to the recording. We surveyed thousands of young people to learn youth attitudes, interests, favorite music, favorite radio host, and the radio station that they listen to the most. We then worked with local mental health experts and radio experts to craft the key messages and integrate them into a weekly radio program. We went to schools to talk to youth to determine what kinds of language they use and to understand their fears, hopes, and dreams. We convened a youth advisory panel of writers who helped develop the storyboard for the drama, helped select characters' names, and helped us identify how youth talk to each other. They ensured that the story sounded real, that it truly spoke to them and their friends, and they also became ambassadors for the show, promoting it in their communities. Sorry, I'm having a little trouble advancing the slides here. Another one of the reasons that the radio program was so successful is that we started radio listening clubs in each school. Club life is very popular in secondary schools in both countries, and we tasked our peer educators with starting mental health clubs. Clubs would meet weekly and would listen to the radio program together. Afterwards, the peer educators and trained teachers facilitated discussions about the topics raised in the radio show, about suicide, rape, exam stress, and so on. The clubs were an important vehicle for ongoing engagement with young people. We developed intra-club competitions, debate on learning competitions, hip-hop competitions. The winning clubs won t-shirts or prizes. Star clubs had the opportunity to win a live broadcast of the program at school, a huge incentive given that each show's host was such a famous celebrity hip-hop artist. So we had a number of successes. We did a fairly significant impact evaluation at the end of this project. So I'll lay them out here. The radio broadcasters truly made the program their own. So we gave them a lot of leverage and a lot of freedom to design the program. We thought that they were best positioned to be able to create a program that truly speaks to and is engaging for youth. They used celebrity interviews, they used vox pops, which are recordings filled with local youth to discuss sexual and reproductive health, employment, anything that the young people wanted to talk about. They went out every month into the field, into the schools with a microphone just to get perspectives from young people. The use of our serialized soap opera proved an effective tool for delivering mental health messages to young people. It spoke about issues that were important to them and resonated with them. The radio program in each country, still, even though the project has ended, the radio program still continues. And it's currently the most popular youth radio show on the airwaves, reaching an estimated 500,000 youth every week. And lastly, the program, as I said earlier, but just to emphasize, the program is putting topics of discussion on the agenda that are and basically don't feel empowered to talk about. Both countries are highly restrictive in terms of the types of things young people are able to talk, and there's very strict codes of conduct. Having for people to hear advice about or ask questions about things that they always want, but never had a place to ask anyone. Young people found an outlet to discuss their problems anonymously through a monthly question and answer show. So once every month, we would have a youth expert or a social worker on the air in studio and just open up the phone lines for a 60-minute show where young people could call in and just ask their questions anonymously and get answers from a social worker or a trained mental health expert. There was also a Facebook page set up in each country, and it became a very popular vehicle for peer-to-peer discussions where young people asked their peers advice about relationships, about HIV, about sex, about anything. And they did it in this sort of peer-to-peer forum on Facebook. Okay, so I'll stop there. I'll leave some time for questions.
Yeah, so let's get straight to the questions. And I thought it'd be very interesting to talk about, what are some of the unique aspects of each of the programs, but more importantly, what are some of the synergies that we see, and what are the best parts that we can take to other parts of the world. So I would invite the participants to type their messages into the chat box or raise their hand, and maybe we can turn on microphones one at a time. I also have a slide of questions that participants have submitted before the webinar began. So maybe take a moment to look at the questions and see if there are any aspects you want to start discussing already. No, I made poor Heather mute herself. Can you come back?
Yes. Should I just jump in and address a couple of the ones that are on the slide?
Okay. Still with us?
So I think a couple of, at least from my experience, that I think I can address. So the first question, what do you see as the biggest barrier to overcoming the stigma of illness, and how do you think it is best addressed? So this is a problem that we continue to wrestle with, actually. So even though we feel like we've been quite successful in putting the topic of mental health, which is a highly, highly taboo topic, and highly misunderstood in East Africa, on the public agenda as a topic of conversation, the stigma is still very, very strong. Even though we've done this huge public awareness campaign, there's very resilient stigmas. I think one of the things that has been quite successful, and maybe Mike can speak to it a little bit more, but here in Canada is just, it takes years and years of it being on the public agenda, and it's happened in a number of different ways, which is what we tried to replicate in Malawi and Tanzania. So one, in talking about mental health in schools has proven to be a big stigma reducer in Canada, which is why we sort of adapted the program to Malawi and Tanzania. So that's been very successful. Public awareness campaigns, so talking about mental health in schools, public awareness campaigns, and also training primary care providers. So once mental health is integrated into primary care, that often starts to destigmatize it, starts to be seen more as an ordinary medical disorder as opposed to something that's not a medical disorder. I don't know if Mike wants to jump in there.
Yeah, I mean, I think in terms of the barriers to overcome stigma is just, in some cases it's talking about it. In some cases, for us at least, we try to get people to experience certain things, so they're more open to the conversation. Because again, I find sometimes when you just start talking about something that does have a lot of stigma behind it, like mental health, you sometimes aren't speaking to open ears. And I think when you have really engaged groups in different scenarios, sometimes those are more appropriate moments to talk about this in a way that will be heard. So, I mean, that, at least from our experience, has been very effective, is with our more engaged groups, that's when we start to open some of the conversations around mental health. And a lot of it's done through experience. For example, from a personal standpoint, like dance, now that you've learned this technique, I want you to try to interpret how you're feeling through your movement. And we would do that in a circle. And sometimes it gets pretty emotional because some people are feeling like they had a bad week, or they have a sick parent who's going through some challenges. And then when you do the reflection piece, people will speak about these different things. So I think there's very creative ways we can talk about it too. It doesn't always have to be a brochure or someone standing in front of a group of people lecturing on what the symptoms of different mental illnesses are. I think there are different ways you can get people to experience what someone else is going through, by stepping them through artistic activities, by stepping them through a day in the life of another person, and hearing people's stories also has been very powerful for us. We really are big on sharing our stories at Unity because we feel sort of the best thing that you have to educate someone is your own personal experience. So we do look for people who have experienced different things in their lives that we want to talk about, so that we're not just, reading a brochure, but we're really talking to our own experience. So I think that's also very helpful.
Actually, you reminded me of one thing that I forgot to mention, which I think is really important. So we found a very similar thing in Malawi and Tanzania, which is that when you talk overtly about mental health issues to teenagers, they're not very interested. So we took a very similar approach to you, is that we just talked about like teenage issues more broadly, as opposed to talking specifically about mental health. And we also found that was a lot more successful, that we just approached teenagers about their feelings and about their day-to-day problems, and didn't really talk about mental health overtly, at least not at first. And then another thing that we also used on the radio program was personal stories. We did that quite a lot as well in an attempt to reduce stigma.
Awesome. Should we move on to another question, or does anyone who's live right now have a particular question that they want to ask about either our work or your work, or ways that maybe things could work together?
Well, sounds like people are being bad.
If not, I can take another one on this list. So another thing that so I've been sort of part of the global mental health community for quite some time through being involved in this work. And so for number 4, I thought that was an intriguing question, was being done globally to scale up mental health services among the youth. Not much is the answer. And I think this is a really big gap in mental health services and service provision and funding that's aimed directly at youth. So global mental health funding tends to focus on adults, and it tends to focus on the most severe mental health disorders, so schizophrenia, psychosis. So rarely are youth the focus of interventions or of funding, and rarely are youth sort of the bits of programs, and especially when you're talking about more of the common mental health disorders, so anxiety, depression, anything to do with suicide reduction or anything like that is very sort of underfunded and underprioritized in the global mental health world.
Yeah, and I think just to speak to that point, I find it's something that takes time to shift, but it can be shifted, I believe. Like, we've had some pretty incredible progress in 10 years from not existing, literally building it from the ground up, to really gaining support of not only the government, but the corporations in Canada, the media, TV stations. We've had that video that I played for you guys was actually aired all across Canada on TV for about 2 years for free. So, you know, we've really broken down some walls and have allowed this message to get out there from a youth perspective, because things weren't structured that way, and we're now, you know, knocking on certain doors and saying, hey, we do this, and all of a sudden new projects are starting 3 years, 4 years, 5 years later because of it. So it's exciting. I always encourage people to share their work and what they're doing, because you just never know who's gonna pick it up and connect it to something that you never even knew about. So I really would encourage you all to just knock on people's doors and try to meet as many people as you can to share with them the work that you're doing, because that word of mouth turns into bringing a platform to youth mental health and supporting young people for this really important issue. So keep up the good work and share that story.
And I happen to know of a pretty excellent platform for sharing your work and getting it out to the world. It's called the Mental Health Innovation Network. Just wanted to get that out there. You know, we always welcome new innovations and new organizations to join and allow people to connect and talk about these things.
That was a good segue.
Thank you. I try. All right, so maybe I will take this moment to segue right into ways to continue this conversation. We still have a couple of minutes, so please don't take this to mean that the question and answer section is over. But, you know, there are plenty of ways to get in touch with us at MHIN and through us to get in touch with the speakers and to talk about this further. So I will leave that up, and I will go back to taking the back seat in case there's any more questions for the two speakers. Okay, well, I guess nobody wanted to ask any more questions. So in that case, I want to thank you all for joining. I really appreciate your taking the time. Thank you to, oh, we do have a question. So yes, Candace, did you want to, oh, okay, you're typing it out. If you have a microphone, you're welcome to turn it on and chime in.
Can you hear me?
Yep, can hear.
Yep.
Awesome. I was just, it wasn't necessarily a question. I was just going to say I found that really interesting. I also work in youth engagement in a mental health initiative and was recently talking to some peers about sort of the opportunity to connect more regularly on best practices in youth engagement and mental health. I was wondering, I don't know if that's something that the Mental Health Innovation Network does or if there's a forum for that, but I was wondering if that is something that you guys do, or and if not, if there would be interest from other people in sort of continuing that conversation more formally and building up that network.
Sorry, so just to make sure I understand the question, you want to know if we can be a platform for more of a network focused on youth issues?
No, I was wondering, I'm not sure, I just found out about the Mental Health Innovation Network, and I'm not sure if there's already a forum on there that exists that sort of provides the opportunity to people who are working in this field to share best practices among each other for different pieces of youth engagement. And if there isn't, is that something that could be part of the Mental Health Innovation Network? And if not, is there interest from others to sort of continue that conversation more regularly? Because I would be happy to organize that conversation on my end.
Yeah, so Amy Cheyenne does have a forum, actually. There's a forum section where we try to encourage our members to go and have exactly those conversations and share their ideas and share their resources and have more one-to-one conversations. It doesn't seem to be very heavily used, but I definitely invite you to create a topic around youth mental health, and we can tweet out individual questions and try to get people into the forum to continue that conversation. Absolutely.
Great, thank you.
Yeah, and I would be glad to join that conversation as well in any way.
Yeah, so would I, Candace. So, yeah.
I'll set that up as soon as we're done here. So everyone who's joining us in this webinar, check into the forums in an hour or two, and there will be a space to continue talking about this.
Awesome, thank you.
All right, well, thank you. So maybe this then is a good way to leave it. Head on over to the forums to keep talking about it. And until then, thank you all again for your time and attention, and join us at the next webinar.
Bye, everyone.
Bye, everybody. Thank you so much.